Okay, so today we're going to be going over some CT motion palpation to find a joint restriction, and then we're going to run you through a mock adjustment, so just a setup and to end range to fix that restriction. So starting out with our motion palpation, I'm going to have my indifferent hand kind of controlling the patient's head while my thumb contact right now is going to be on the right side of his spine. Starting at C6 and moving my way down to T3, I'm going to basically bring his head into flexion and rotation, pushing on C6 to start, just the right side of that spinous process, pushing it over, getting him to end range, and then springing it to see if there's any loss of motion there. And then I'm just going to do the same thing all the way down to T3 with that rotation. And then the next thing I can do is go back up to C6, and then I can assess for lateral flexion. So I'm just going to laterally flex his head over and over pressure. C7, over pressure, T1, over pressure, all the way down to T3. And those feel pretty good on that side. Next, I'm just going to switch to the left side. So using my right hand here, I'm going to start at C6, flex his head and rotate him over, moving down, feeling for any restriction. One more, and then I'm going to move into my lateral flexion. Pushing L to M on that spinous again, feeling for any loss of spring. So that left side actually felt pretty good, but on the right side, there was a little bit of restriction in his T2 area. So he was left rotated with a right rotation restriction, so his spinous is deviated to the right. So I'm going to have my patient lie prone on the table, please. I'm going to ask them for permission to open up their gown. I'm going to find my contact on that T2 spinous process. So I'm actually going to be on the same side of the table as my restriction for this guy. I'm going to take a thumb contact in a fencer stance, nice and close to the patient. I'm going to take tissue slack L to M and kind of move those traps out of the way with my hand. And then I'm going to go L to M onto that spinous process, have the patient turn his head to the left here for me. And then with my indifferent hand, I'm going to be contacting the occiput, tractioning I to S. I'm going to get nice, really close to my contact with my hand at a 90-degree, or with my arm at a 90-degree angle to get a good force. I'm going to traction up, get really close to my contact, and then my vector is going to be P to A to stay on my contact, and L to M to push that spinous over to the midline.